The helicopter is one of those techniques that is relatively basic, and though there are some details to it to really optimize how you perform it. So I'm going to go through them here so that you can, when you practice, you can integrate those extra pieces of the puzzle to make your helicopters even better, your hip mobilizations even better. The first thing, you want to get in nice and close to the opposite side leg. So you lift up the leg that's closest to you, scooch in, get nice and low in your stance. A lot of the times people are up in a different stance, and if you can be down like this in what we call a diamond stance, I would highly recommend it. It becomes so much more efficient. If you're taking care of an injured knee or a knee that doesn't bend all the way or something like that, then by all means make the adaptation to take a different stance. But if you can be in a diamond, I'd really recommend you use this diamond stance to keep you nice and low, to keep your center of gravity low, and to keep the work reduced. Then we bend the knee and the hip to about 90 degrees of flexion each, and this is what we would call our starting position. From here, we're going to head up towards the shoulder and out to the side to begin with. As you do that, make sure, please, that you always keep the foot more medial than the knee, which actually means you're going to be taking some external rotation at the hip throughout the entire range of motion. Because if you don't do that, we have a higher likelihood that people are going to get that pinching sensation in the front of the hip. By increasing that external rotation for everyone, or by implementing that external rotation for everyone, you're decreasing the likelihood that there's going to be an increase in sensation and all of a sudden this awakening discomfort, basically. So it keeps them relaxed, it keeps them calm, and it gives them the best chance to let go of their hip, because that can be a really challenging task for people. So always keep the foot as the most medial piece, even when you come back in towards the midline. Oftentimes what happens is people will drive back in towards the midline and end up getting some internal rotation. And for a lot of people, even just that drives a pinching sensation at the hip. So we keep the foot as the most medial piece the entire time. Also, I'm not trying to take the knee in towards the chest. Notice I'm going directly out towards the shoulder. Same reason. The more you drive the knee in towards the chest, and the more you drive the hip into adduction and flexion at the same time, the greater likelihood you have of getting that exact same pinching sensation. So I'm going to the shoulder and then laterally from there. I could also go in the opposite direction, but also what I've noticed over the years of practice is if I go in that direction, I once again increase the likelihood of pinching in the hip, and I also increase the likelihood that they're going to be doing the work for me, which is something that in the way that I approach the practice, I'm trying to avoid. I'm trying to get them to give full surrender of their hip and leg to me so that I can move it entirely, okay? As I get up through that higher range of motion, I'm trying to get one arm straight so that that's more efficient for me as I use my avatar rock, okay, which is just that sort of circular rocking technique. If my arms stay bent, that decreases its efficiency, and so I want to try and modify my distance a little bit. Usually it will mean moving away a little bit just to get that leading arm straight. Also, you'll notice that the opposite leg, which is something that I call the indicator leg, is lifting and moving. This is a good sign that I'm getting a full range of motion going at the hip. If it's not moving, chances are, for the vast majority of people, I can go bigger. The one thing that you would avoid in terms of lift is if the foot ends up lifting off the ground as well. That's a sign that you've gone a little bit too far. Of course, you're also paying attention to all of the other signs of sufficient range, like expression, like breath, like any holding in the extremities that seems as though they're trying to sustain cool, calm, and collectiveness in amongst a lot of intensity. Okay, so pay attention to all of those things as well, and keep an eye on that foot. Not only is this a great way to just open up the hip, create a little bit of space, facilitate a little bit of extra movement here at the hip for someone. It also helps with low back things, and it's a really great preparation for something like a twist, because if you get a full range of motion, I'm little by little moving the pelvis off center and bringing it over towards me. So it's a great preparatory tool as well as being a standalone tool. If you have any questions about this helicopter, this hip mobilization, please do reach out. Otherwise, enjoy. Make sure you exchange so that you get this as well as give it, and feel free to let me know how you go in the comments.